If stretching your sciatica has ever flared your leg pain instead of helping it, the problem usually isn't your back. It's the intensity and the type of stretches you may be using. In this video, I'll walk you through a simple 4-step stretching routine you can do on the floor that targets the tight areas most likely to aggravate sciatica without pushing into pain or stressing your back. Now, you're also going to learn exactly how to do each stretch, how to breathe during the stretch so that your muscles can actually relax, and a 30-second reset so that you can do this between stretches if the stretches feel painful or guarded. And stay to the end because I will also give you 2 bonus stretches, one commonly used for a disc-related pain and one for a spinal stenosis, so you can choose which one actually fits your symptoms. I'm Dr. Tam. I'm a chiropractor here in San Jose, California, and with more than 20 years of experience helping people with disc injuries, joint pain, nerve pain, and sciatica who has tried everything and still live with pain, I created this channel to give people real, non-surgical, science-based solutions that actually address the root cause instead of masking symptoms. Now, if you want to protect your spine, understand your condition, and learn the treatments that help people get long-term relief, subscribe to my channel. I post a new video every week. Before we start, here's how to use this video safely so it actually helps. You should feel a mild stretch or a sense of easing, not a sharp pain or shooting symptoms or anything getting worse as you move. Now, if that happens, skip to the next stretch. For now, move slowly, keep the effort light, and breathe the entire time. Smaller, easier movements usually calm sciatica faster than forcing the range. Now, if something feels too intense, cut the effort in half or shorten the hold. Now, consistency matters more than pushing deeper. Now, let's start with the first stretch, which targets the glutes and the deep hip muscles that often drive sciatic leg pain. Exercise number 1 is a supine figure 4 glute and a piriformis stretch. You want to start by lying on your back. This position helps to take pressure off your spine and allows your body to relax. I want you to bend both knees with your feet flat on the floor. You're going to go ahead and cross one foot over the opposite thigh, making a figure 4 shape. Start on the side where you usually feel that your sciatic symptoms are worse. Just stay here for a moment and notice how it feels. For many people, this alone will create a gentle stretch in the hip or the glute, and that may be enough. Now, if you want a little more stretch, using both hands, grasp the knee of the foot and cross it over your other knee and slowly bring your knee towards your chest. Once you feel a slight tension, slowly angle your pull so that you are pulling up and sideways towards your armpit. Now, only come up to a mild controlled stretch. There should be no sharp pain, no shooting symptoms down your leg. Keep your shoulders and your neck relaxed and let your lower back stay heavy on the floor and as flat as possible. Now, if done correctly, you should feel a deep stretch in your piriformis and glute muscles. Hold this position for about 10 to 15 seconds, then gently relax. Now, that's going to be 1 rep. Repeat for a total of 5 to 10 reps on this side. As you hold the stretch, focus on your breathing. Inhale slowly through your nose, then exhale through your mouth like you're trying to fog a mirror. Now, each exhale should help the hip to soften without forcing it. Once you finish, switch sides and do the same thing on the other leg. Now, even if your pain is only on one side, stretching both sides helps to keep your hips balanced. Now, I want you to complete a total of 3 sets, resting briefly between sets if needed. If at any point the stretch feels too intense, reduce the range and amount of pull. If symptoms increase or travel down the leg, you have to ease off right away. When you're done, Take a moment to notice, how does your hips, how does your legs feel before moving on? Next, we're going to add some gentle hip rotation to restore movement without stressing your back. Exercise number 2, supine windshield wipers. Now, with this exercise, you're going to, again, lie on your back with your knees bent and feet flat on the floor. Go ahead and bring your feet slightly wider than your hips just to create some balance. You could keep it closer if you'd like, but you want to relax your arms next to your body. Keep your core engaged the entire time. Now, from here, gently let both your knees fall to one side, then slowly move them back through the center and then over to the other side. Keep the movement smooth and fluid like windshield wipers. There should be no forcing and no bouncing. Keep the range small and comfortable. You're not trying to touch the floor. Let gravity do most of the work while your hips gently rotate. Now, your low back should feel supported the entire time. Continue moving side to side for 10 smooth reps, counting 1 rep each time you move from one side to the other. And do not pause until the end. Now, you got to complete 3 total sets, resting briefly if needed. And as you move side to side, breathe slowly and easily. If one direction feels tighter, that's normal. You can move a little slower through that side, but stay completely pain-free. If leg symptoms increase or start to travel, reduce the range or slow the movement down. Now, when you're done, pause in the center and notice, how do your hips feel? How does your low back feel? Next, we're going to move on to the hamstrings and gently address nerve sensitivity in a controlled way. Exercise number 3, supine hamstring stretch with a gentle nerve glide. Now, again, stay lying on your back. Bring one knee towards your chest and place your hands behind your thigh. Keep your knees bent to start, and we're going to begin with the easiest version first. From here, gently straighten the knee until you feel a mild stretch in the back of the leg. Now, this should feel comfortable and controlled, not intense. Do not lock the knee and do not force the movement. Hold this position for about 10 seconds, then gently bend the knee and relax. That's 1 rep. Repeat for 10 reps on this side. If your symptoms stay calm and this feels okay, then you can progress to a gentle nerve glide. Slowly straighten the knee a little bit more, then bend it back again in a smooth, controlled motion. Think of this as an in and out type of movement, not a long hold. Now, if tolerated, you can add small ankle pumps at the top of the movement by gently pointing and flexing your foot. This helps the nerve glide without stretching it aggressively. Complete 10 smooth reps, then switch sides. Even if your pain is on one side, always do both sides to keep things balanced. Perform a total of 3 sets, resting briefly between sets if needed. Throughout the stretch, keep breathing and stay relaxed. If leg pain increases, symptoms start to travel, or anything feels sharp, return the knee to the bent knee version or reduce your range. When you're finished, take a moment. Notice how your legs feel. Next, I'll show you an alternative nerve gliding stretch that uses the wall for support for those of you who found this stretch a little bit difficult. Exercise number 4 is a supine wall hamstring stretch with a gentle nerve glide. Now, if you found it difficult to hold your leg while performing the nerve glide stretch, an alternative method is to use a wall to support your leg. Now, in this stretch, you will lay again on your back, bending one knee and placing the other leg and heel on a wall. Keep your knee bent slightly to the point where you feel a mild stretch. Now, for some people, that's all you need. However, if you want to increase the stretch, you can then pump your foot up and down, and this accomplishes the nerve gliding portion of the stretch. As you bend your foot up and down, your leg and knees will also bend up and down naturally. Throughout the stretch, Keep breathing and stay relaxed. If your leg pain, again, increases, symptoms start to travel, or anything feels sharp, lower your heel position so that your knee is in a more flexed starting position. When you're finished, take a moment. Notice again, how do your legs feel? How does your back feel? Next, I'm going to show you a quick 30-second reset that you can use when stretching feels difficult or when your symptoms are flared up. Exercise number 5. This is a 30-second breathing reset. And this can be done if stretching feels difficult, pinchy, or seems to flare your symptoms, a little bit more. Use this quick reset first. Now, it helps to calm your nervous system and reduce muscle guarding so the stretches feel easier. Again, lie on your back with your knees bent, feet flat on the floor. Place one hand on your belly and the other on your lower ribs. And this way you can control and feel your breathing. Inhale slowly through your nose for about 3 seconds. Then exhale through your mouth for 5 to 6 seconds. Again, like you're trying to fog a mirror. As you exhale, let your ribs soften down and feel your lower back get heavy against the floor. There's no effort here. Just let your body settle. Take 3 slow breaths just like this. Many people notice that their muscles will relax and the stretches feel less guarded or less pinchy right away. You can use this reset before stretching, between stretches, or anytime your sciatica feels tense or reactive, especially during a flare-up. Now, keep watching because I'm going to show you 2 bonus stretches that help you explore which direction of movement your sciatica responds to best. Now, for some people, leg pain feels better with gentle forward bending, which is common with conditions like spinal stenosis. For others, symptoms improve with gentle backward bending, which is often the cause of disc bulges or herniation. These 2 bonus stretches will let you safely try both directions and see which one gives you relief. Now, this is not a diagnosis. It's simply a way to notice which movements calm your symptoms so you can make a better choice for your body. Bonus stretch number 1 is a backward bending for disc-related sciatica relief. This first bonus explores gentle backward bending. It's called a prone press-up, or sometimes called a cobra stretch. Now, some people notice their leg pain feels calmer or lighter with this direction of movement, especially when the symptoms are related to disc irritation. Go ahead and lie on your stomach with your hands under your shoulders like you're setting up for a push-up. Keep your hips relaxed and in contact with the floor. Slowly press through your hands and lift your chest. Only come up as far as you feel comfortable. There should be no sharp pain, no increase in leg pain or leg symptoms. Hold the top position for 1 to 2 seconds, then slowly lower your back down, and that's 1 rep. Perform 10 controlled reps. If this feels helpful and your symptoms stay calm, you can work up to a total of 3 sets, resting briefly between sets. If your leg pain increases or starts to travel further down your leg, guess what? Stop and don't push through it. Bonus stretch number 2, forward bending for stenosis type symptom relief. This second bonus stretch, it explores gentle forward bending. It's called the child's pose. Now, for some people, they notice relief in this position, particularly with symptoms that are more sensitive to standing or walking upright. You're going to go ahead and start on your hands and knees. Slowly sit your hips back towards your heels, letting your spine gently round as you relax into the position. Rest your arms wherever you feel comfortable and allow your head and neck to relax. Hold this position for 30 to 60 seconds or longer if it continues to bring you relief. Breathe slowly and easily the entire time. Now, if this position eases your leg symptoms or back tension, you can use it as needed throughout the day. You now have a simple, safe routine that may finally help calm your sciatica and make daily movements feel easier again. Use these stretches consistently. Keep the effort gentle and pay attention to how your body responds over time. If you found value in this video, please like and share it so others dealing with sciatica can find relief as well. And if you have any questions, drop them in the comment sections below. I do read them and I use your questions to guide my future videos. And don't forget to subscribe if you want safe, non-surgical, science-based solutions to relieve pain, protect your spine, and restore your mobility so that you can start living your life again, not just going through it. I also have another video that you should check out. And this one shows you the 10 best exercises for an L4-5 and an L5-S1 disc bulge, especially if your sciatica is coming from a disc-related issue. Go watch that video next.